What was that? Heart transplants gone wrong, oral care gone wrong, and health teachers gone wrong. Today, we are reacting to the medical scenes and over-the-top injuries from this highly popular YouTube channel, MeatCanyon. All right, let's dive right in.
Today, I just bought my most terminally ill fan his replacement heart.
Oh my god. Is that Mr. Beast?
I was just thinking that. I'm like, why does this person look so similar to Mr. Beast? You have the monitors in the back, you got the IV fluids going, really good depiction. And if I'm looking at the monitor, the heart rate's going good. The blue line in the back is actually the respiratory rate typically. So the respiratory rate of this individual is cruising. It is going fast. That's not normal. The heart is actually in a cooler. You'd be actually surprised that they get transported in a cooler, literally by somebody in a car from another facility, not even an ambulance per se.
Do you want a heart to save your life? Or do you want a Mr. Beast wrap Tesla?
Good boy.
Now, you have to search these 100 coolers filled with human hearts to find the Tesla key.
What? Wait a minute. Now, it wouldn't be directly on ice. It would be wrapped and it would be in like a cool container, but not necessarily on ice because you don't want it to get frostbite or freezer burn, right? Because you don't want it to actually get frozen to that tissue.
Man, I wish I was terminally ill. Your boy be driving a Ford Explorer.
Bruh. So the monitor is giving the asystole noise, like the brrr, because it's not on the monitor. So if we actually ever hear that noise at the hospital, the first thing that we do is actually check to make sure that the monitor is attached to the person.
Yeah, I mean, I don't know if this guy should be doing this.
Oh my gosh. Why is the guy with the yellow shirt stomping on a heart? It's funny he's stomping on it, but I've actually literally held a heart in my hand like multiple different times, and they're super delicate, super soft.
He looks really sick, Jimmy.
And this guy's just throwing them around. What was that? You would expect the hospital staff to come running in to check the patient if the monitor is going off like that.
Man, I'm looking to play some Among Us with my boys.
The belly button is actually like a crazy, interesting, weird part of our bodies, but that's literally how we got all of our nutrients into our body from the womb via the placenta.
Oh my god, it's Mr. Beast! Oh, I've been a fan since 1 million subs. Oh man, this is awesome. Always great to hear. Here's $5,000, and we just planted 2,000 trees outside of Liberty, Missouri in your name. Thanks for being a fan. Bye-bye.
Oh my gosh. We're not allowed to accept bribes. We're not allowed to really accept large gifts either. Sometimes, patients will give food, cards are fine.
Well, I have a donor coming out of state to bring me a new heart in a few days, so I think I should recover okay.
I'm not sure exactly what he means by having a donor come in a couple days, because typically a heart outside of the body only lasts anywhere between 4 to 6 hours.
All right, children, gather round. Today we're going to go inside of a beehive or, I don't know, a flower or some shit.
Miss Frizzle, I don't want to learn about that stuff. I want to learn about wet ass pussy. Wop, wop, wop.
You can't say these things at school. Come on. Oh my gosh. Like, no. No.
You all know I hate that song so much.
Miss Frizzle.
What? The thing I always worry about when somebody gets hit on the side of the head is if they actually have an epidural hematoma, basically a bleed in the brain where you have a laceration or injury to the middle meningeal artery.
Hop in the bus and let's get to learning. Whoa, this place is cold and stinky.
Yeah.
Oh my God. I feel like I'm in the female anatomy and we are in the vault, the vaginal vault. It could have odors for multiple different reasons. There are good bacteria that grow down there to protect it. And sometimes there could be overgrowth or abnormal growth due to taking medications or antibiotics, which are normal. And if there is any odor that is down there, you definitely need to get checked out by your physician, your OBGYN, or your family medicine or internal medicine doctor.
Help me, please.
Waterform attack!
A puncture wound knife to the lateral aspect of the neck. You have your carotid artery and your jugular vein. And if you hit that, the vein's going to ooze out blood, like pool out like it is. And then arterial blood will be arterial or shooting every time that the heart is beating. And you can bleed out pretty fast. What? Can anybody like pinch their nose and suck it so it like stays shut? I mean, that's a skill to have. Let me try. No, mine doesn't.
Are you the dentist?
Why, yes, this is my practice.
We need your help. My friend is in desperate need for oral care.
Oh my goodness, I like it. Oral care.
We're totally booked for the day. Almost the whole town was assaulted by a flying creature.
Usually people with acute dental or mouth injuries will come to the emergency department, and there are certain things that we can do, but most of the time we temporize it so you can actually get to the dentist the next day.
We have a bag of teeth.
Wow.
Tooth Fairy, just easy down now, okay?
Did you guys ever believe in the tooth fairy, or do you still believe in the tooth fairy? Let me know in the comments.
Jesus Christ, please don't act up.
Oh, hold on to the tooth fairy. Oh my gosh, the fury.
Daddy.
That wasn't even like using the pliers to pull the teeth out. That was just destruction. Oh my gosh, oh my gosh, oh my god. What was that? Now, typically we actually see people's teeth fall out from different types of trauma. A lot of times they'll get fractured through the tooth that's actually sticking out versus a fracture where the tooth is up into the bone.
I wouldn't mind.
What?
Oh, I have teeth again. Where are we?
What? Oh my god, sometimes that happens when actually somebody uses any type of anesthetic or agent that they might use to have somebody do conscious sedation or be put to sleep. When they wake up, a lot of times you're confused. What's the situation? What's going on? But we always keep you on a monitor until everything clears out of your system. Oh my gosh. So I've never seen MeatCanyon before. This was so intense, so interesting. There were some medical components to it. There was some craziness to it. I actually really enjoyed it. I do definitely need to check out longer format of this. But if you guys enjoyed this, please let me know in the comment. And do me a favor, check out the limited run merch of Dr. ER, okay? It's down in the link below, so check it out. And as always, make sure that you check out this playlist right here. And as always, make sure you subscribe, turn on those bell notifications, hit that like button for me. Thank you so much for watching, and stay healthy, my friends.